All right, so let's think some together about the treatment of OCD. So given what we've talked about, right, we know we're not going to use the same kind of cognitive behavioral techniques that we talked about with anxiety because we're not going to find effectiveness in suppressing or distracting from the thoughts, from the obsessions. We also know that because we understand that there's a pretty robust biological etiology, both genetic and in those brain areas that we were just talking about in the previous video, that we're likely to have some biological intervention, pharmacological intervention. And then also because we talked about the importance of Mauer's two-factor theory from an etiological point of view, that probably is going to inform our treatment as well. So you see on the slide in front of you the two main approaches to treatment for OCD are going to be medication treatment, and that's going to be those SSRIs again, the same ones we talked about in the previous two chapters, that are going to be very effective at managing the biological process that contributes to OCD. And then therapy almost always is, or at least includes, exposure and response prevention techniques. Therapy might include some other forms of talk therapy to manage co-occurring issues or to manage the distress of just the experience of the disorder. But in order to address the direct symptoms of OCD, to address the obsessions and the compulsions, we're going to use exposure and response prevention techniques. And those are very much connected to the idea of Mauer's two-factor theory. So exposure is we're essentially exposing the person to the stimuli, the situation, the event that is related to the obsessions. So essentially, the person has an obsession that says, if I don't wash my hands frequently enough, I'm going to become ill from germs. And the exposure would be to washing your hands just once for 20 seconds, right? The recommended amount, and then not washing anymore. Or exposure might be if I touch something, if I touch my school books when I'm home, something bad will happen. Or if the only way to keep myself safe is to count to 10 after something happens, right? Any of those kinds of things that we expose is to the obsession without responding to it. Right, so that's why it's twofold. The exposure is to the stimuli, the situation, and the response prevention is to not a person prevents themselves with support from engaging in the compulsive behavior. So they have the thought that I need to wash my hands for 10 minutes. We expose them to something less than that, right? So not washing their hands for 10 minutes. Response prevention is the hand washing. Maybe that's not the best example. So exposure is to touching the thing from school that then raises the anxiety, right? And the obsessive thought thinking related to the anxiety. Response prevention is that you don't get to wash your hands in response to touching something that maybe was contaminated. The exposure is to walking out of your house and getting in your car, and just doing that. The response prevention is you can't go back and check to see if you locked the door. Right, and so both things have to be happening, and these happen typically in a stepwise fashion. We don't just throw somebody into the deep end of the pool here. That you work with a therapist to create essentially a systematic desensitization approach, just like we talked about in the anxiety chapter, so that this starts with something that the person believes they could tolerate, even if it's with anxiety and discomfort, and then we work up to maybe higher levels of exposure and response prevention. Exposure and response prevention are really important techniques. Understanding that we're exposing from Mauer's two-factor theory, right? It's really important that you understand that the exposure is essentially an extinction, right? That we expose that. So if we assume we have a classically conditioned connection between a stimulus and anxiety. And so we expose for extinction to happen to see that nothing bad is really going to happen. The response prevention is to stop the person from engaging in a behavior that is focused on negative reinforcement, right? So make sure that that doesn't happen. All right, and so hopefully you'll post questions in the discussion about obsessive compulsive disorder so that you can ask questions about things that are maybe still not making so much sense to you. But I want to move on to thinking about body dysmorphic disorder. And in body dysmorphic disorder, we're going to talk about the idea of the connection between body dysmorphic disorder and OCD in the sense of that the similarity that they have is intrusive thoughts that cause discomfort and anxiety. We don't necessarily have the same compulsive behavior with body dysmorphic disorder that may just have the obsessions, though some people with body dysmorphic disorder do engage in compulsive behaviors, either in checking rituals or in even cosmetic surgery as a compulsive behavior, and we'll talk about that. We'll also talk in the upcoming video about the connection between OCD and hoarding disorder, and until recently, hoarding was just a subcategory of OCD, but now we treat it as a separate disorder. But you'll see when we talk about hoarding disorder, those similarities in the obsessive thoughts and then the compulsive behaviors, which is the hoarding behavior. But we'll pick that up in a third video. Okay.